Welcome, kindergarten parents. My name is Lori Rasmussen, and I'm one of the school nurses here in Cedar Falls. We know that some of you are new to our district and some of you are returning Cedar Falls district parents, and we are excited to have all of your children in our kindergarten program. You can see at the bottom the name of the school nurse who will be at your child's building. The first really big thing that comes up for our kindergartners is immunizations. Each child in Iowa public schools is required to have these listed vaccinations. They must have at least started each of the 5 series before they can begin school. And then they will have 60 days after school starts to complete them. Iowa law requires that they have at least those beginning shots and their immunization form on file at your school before they may be able to attend even the first day. So do check on this right away. We can look in the Iowa Immunization Registry for vaccines of any of our kids who had their immunizations in Iowa. So if you would like to email us, if you want to know if your child still needs more or not, we can look that up for you. However, if you are from out of state or out of country and your child did not receive shots in Iowa, we have no way to access those. So do find your child's immunization sheet and get that to us as soon as possible. A physical is also required for kids starting kindergarten. It does not have to be on our specific physical form, and it can be within a year of the start of school. So if your child had a physical or well child check since August, middle of August of 2019, that would be acceptable. And your doctor can just fax us or give you a copy and you can drop off that physical on whatever form they used. It does not have to be our form. Lead screening is just for your information. We do not handle this through the school. When our physicians check your child's lead levels, they will send that directly to the state. So we don't really have anything to do with that, but I just wanted you to be aware that your child will be tested and that is sent directly to the state. Dental screening is required for incoming kindergartners. Also will be required again when they are freshmen. Iowa does have a program called iSmile, which is handled for us through Blackhawk County. And the iSmile staff will come to the school and do dental screening for any children who were not able to get to their own dentist. There is a form for that as well on our website. However, if you, with offices being closed and the way things are right now, if it's just not feasible to go to the dentist, don't worry, because we will be sending home a permission form in the fall for any children who do not have a dental form, and see if it is okay with you to have the iSmile folks do that screening for them. Vision examination is the same sort of thing. Iowa requires it for kindergarten and 3rd grade students. And we partner with the Lions Club here in Cedar Falls. So the Lions Club folks will come and do that vision exam for preschoolers and kindergartners. And that too needs a permission form signed by you to be able to do. So we will be sending those permission forms home in the fall as well. So once again, unless your child is having vision concerns, don't worry about trying to get in right now. We will be able to take care of this at school in the fall. We do give medications at school, both prescription and over-the-counter medications. They only can be given with your written permission, and there is a medication administration permission form on our website. They need to be in their original containers. Prescription medications have to have the prescription label intact. That is considered the doctor's permission form. And especially watch medicines that come in a box, like an inhaler or an EpiPen, as sometimes they put that label on the box and not the medication. And so do send the box with that medication. If you want to have over-the-counter medications such as Tylenol in case of headaches on school available, you would send that in its original bottle, sealed before it has been opened, a new bottle, and then sign that permission form. Whoop, I think I missed one. It is important for us to know health concerns with your child. So if you do have some concerns that could come up during the course of the school day, such as a seizure disorder or asthma or something like that, do let us know those concerns so that we can be prepared for them. We also would like to share that with their classroom teacher, so their classroom teacher is also prepared, if that is okay with you. And so do keep us informed of those. We also do write health plans for students who have some sort of health concern that would be addressed at school. And so your school nurse may be contacting you to get information for that healthcare plan. Food allergies are important for school. I want you to know that all of our school lunches are completely nut and nut product free. So nuts seem to be our most common allergy. So you can know that school lunches are safe for your children with nut allergies. However, there are other allergies out there sometimes too, and we do have a diet modification form that would be signed by you and the doctor so that our school lunch service can make a substitution for your child. For example, with a dairy allergy, they would substitute something different for the milk. So do let us know if your child has an allergy. We also give that information to teachers, and they would give that note to their classroom parents that there's a certain allergy in the room and to please avoid that food with classroom treats. So they would not say your child's name, but they would say the allergy. Please let us know if your child would have a communicable disease, such as those listed on the sheet here. They are followed by us and tracked. By district policy, we do not send notes home anymore with a class where there is a case of one of those diseases because of confidentiality issues. However, if there ends up being several cases in a classroom, then we discuss it and decide if we need to send a note. So do just try to keep us informed on those, but figure most of them probably will be going through the school during the year. We have a little 24-hour general guideline for you to just keep in mind for when to send children back to school after they are ill. So if you can just keep that 24-hour rule in your head, they should be 24 hours free of vomiting, free of diarrhea, after they've kept their temperature down to normal without medication. If they had a disease that required antibiotics, such as strep throat, they should be 24 hours on their antibiotic. Lots of times the next morning after kids were sick, they feel better, and it's tempting to send them back to school, but they often fade throughout the morning. So do give them that 24 hours to rest and recuperate. We do have several things going on in our office. We do administer medications. We will do assessment and management of injuries and illnesses and call parents. We coordinate the health screenings, and along with the other ones I mentioned, we also have Area 7 coming into our school and doing hearing testing on all of our kindergartners, and we will be checking color vision. So just know that those would be coming. If you need assistance with a community resource, we would be willing to help you with that and would love to help you. Encourage healthy habits. We do like to come into the classroom sometimes and teach some education kind of things for health. And our goal is, of course, to keep kids healthy and at school as much as possible. Thank you very much. Do feel free to contact any of us with questions or individual health concerns. Have a great day, and we'll see you in the fall.